Okay, good evening, everybody. Welcome to another episode. It's Mondays with Maishi. This is Moshe Norman from Lakewood, New Jersey, with tonight's featured guest, Dr. Seth Scott from South Carolina. Actually, you don't say it like that. Oh, I guess we'll hear why. Maybe not yet, right?
Right.
Okay, want to just give a shout out to those who turned on your videos. Thank you for turning on your videos. If anybody else can turn on your videos, you know by now that we love to see faces and to interact with people and get nonverbal feedback. One of the things we do is we spend a few hours after the show analyzing everybody's facial features, and no, I'm just kidding. We just like to be able to see and get as personal as we can on this show. So thank you, Shashi and Chama and Yosef and whoever else can turn on the video. We'd love to see you. Of course, just another housekeeping reminder for those of you who have questions or comments, please tap the reactions tab on the bottom right of your screen and raise your hand. And this way we'll know that you're waiting and we'll call on you, and love to hear your comment, question, or thought. Tonight's conversation is going to be perhaps one of the most fascinating discussions that we had on Mondays with Moshe, because we're going a little bit out of the box of the process of therapy. You know, it's been a number of years that we're talking about the process of therapy, and I'm thinking to expand, the discussions a little bit. Dr. Seth Scott, I hope it's okay if I call you Seth.
Yeah.
Seth and I have been organizing this talk for a couple of months now, and this, of course, all began well before the conflict that as we know it, in the Middle East, in its present day form, unfortunately. And we decided, that as part of the discussion, we hope to incorporate and include some discussion that may come up in that context tonight. So hopefully the conversation will be respectful. Hopefully it will be a little charged and meaningful. And I hope that everybody gleans something from it, from the, some of the time that I spent speaking with Scott. I think that, with Seth, it's hard to have a last name and a first name as a first name, right? I have that too, Norman, right? So some of the discussion, I think this is going to be a really rich conversation, and I think it's going to be something that's different, perhaps something that many clinicians have never really put much thought into. So it will be stimulating in that way. So Seth, thank you for agreeing to come on and joining us tonight. Thank you. And giving everything
thanks.
time.
It was great. Okay. Thanks for having me.
So just to be clear, Seth is not a social worker or a psychologist, but has a PhD in counselor education and supervision, and is actually a professor at Columbia International University, which is in Columbia, South Carolina, which is somewhere near Charleston. I don't know exactly, but within a few hours, I guess, right? Yep. It's close enough. So it's not to be confused with Columbia University, but Columbia International University, not the one in New York City. So thank you for coming on, and tell us a little bit about what does a PhD in counselor education and supervision mean, and how did you get into this field, and how on earth did you get into talking on this topic of differences in therapy and things like that? Tell us a little bit about yourself.
Yeah, that's great. So yeah, I'm also a licensed counselor, LPC, licensed professional counselor, and counselor supervisor. And so yeah, it's more the counseling realm. Counselor education supervision is the PhD you need to be able to teach licensed counselors in KCREP programs. So the field of counseling has their own credentialing. And so I grew up in Metro New York, West Orange, right outside New York City. And my dad runs a rescue mission there, Market Street Mission in Morristown. And so growing up, I was involved in kind of around addiction recovery, counseling, things like that. And growing up in Metro New York, kind of the speed and vibe of Jersey, and didn't want to go into counseling. And so I ended up going to college for biblical studies and intercultural studies. Moved to Ireland and lived there for a while with my wife, who I met in college, and then realized kind of I didn't know enough about people as I was trying to work with people. And so I went back to Virginia Beach Regent University for my master's in counseling, and then worked in the Boston area in clinical practice before going into teaching. So even now I teach full time, but I also run a private practice and supervision services for people in South Carolina. And my teaching area, my focus of teaching, I've taught at different colleges, a small Bible college in Iowa, Moody Bible Institute in Chicago, and now at Columbia International University, all evangelical Christian schools, where our approach to counseling is a faith integration model. So trying to teach and understand, where do our values come from? How do we understand, and be aware of our belief system and our value system that informs our view of the world, so that we can ethically work with people in a counseling setting without just kind of imposing those beliefs on others.
Yeah.
And so my areas of research, dissertation work, and publications have been around identity, in that area, which is how I started writing on it.
Cool. Okay. Well, that makes a lot of sense. I think that one of the most we'd be remiss if we didn't say that one of the most poignant part of tonight's show is that I'm an Orthodox Jew and you're an evangelical Christian. And how could we have a better conversation about values and faiths and how they intersect with our therapy work if we wouldn't have two people of two different faiths on? So this is going to be the most exciting thing for me. But Seth, one favor, let's not make this into a Torah class, okay? Let's keep this clinical. All right.
Yep.
Okay. So, I have some questions, but before I have questions, I know that you've spoken on this topic a lot, and I'm wondering if you have a sort of spiel or model that you work from that's coming from a framework and a conceptualization of what we therapists sitting in the room with clients who are going to, clients, let's say it like this: clients present with all kinds of challenges to the therapist. Sometimes it's personality challenges. Okay, somebody comes in who triggers me. I know that I get personally triggered from the real serious narcissists. Okay, I become extremely uncomfortable. I become more comfortable with them over time, but like that's a trigger for me. Mm-hmm. Other people become uncomfortable with suicidal clients and patients, right? But here we're talking about something that's some trigger point may be conscious, in somebody who has different values than they do, or it may be unconscious in thinking, no, that's okay. I know they're different and I'm different. Tell us a little bit about like your conceptualization and framework on how that works.
Yeah, so it actually started as I was working for proposing accreditation studies for KCREP, which is the counseling accreditation, and in the field of counseling and similar in psychology, there's a lot of character traits or dispositions that can't be measured academically. So we have all of the academic knowledge that we take licensing exams and we have all that. But the things that make us effective as counselors or as psychologists are these non-academic character dispositions, like openness, teachability, willingness to learn. And those are harder to conceptualize, harder to measure. And in my kind of processing about them, realized that we want virtues as counselors, as people in culture. We want virtuous individuals, but virtues don't just come out of the blue. They're founded in having purpose that's grounded in our values. And so in most of our codes of ethics, we have these values that we ascribe to, but we don't talk about the belief systems that underlie those values. And so the reality is, most of the time we want people to have values, we want people to hold to virtuous behavior, but we don't want them to impose their belief systems. But it's our belief systems that inform our values, our purpose, and our virtues. And so as we're sitting with clients, most of the time, the value tensions that we deal with are people that are close to us in values, but there's some disjointed piece. And so someone who maybe holds similar values in one area that you would agree with, but then all of a sudden they say something completely different from you, that when you're caught off guard, that's where you're usually stuck. Whereas if you're going into a counseling session knowing someone holds a completely different value system from you, you're aware of it, you're ready for it. And so part of this exploration is saying, all right, well, what drives what our values are? Where do they come from? So that we can be aware of them, so that in a clinical setting, we don't just make assumptions about our values or other people's values, so that we can kind of help clients to gain health in being able to align what their ideal life is with what their real life is. Right? That's kind of the goal of counseling.
Okay, so let me just break down and slow down what you said. If we take for a minute a friendship, okay, you and I are good friends. We've known each other for 15, 30 years, whatever it is. And I know that no two people have the same values to the exact, right? To the T.
Right.
So how is it that you and I could be in a relationship and we can have different values and be respectful of them? And when you throw a curveball at me, I can sort of tolerate that yours is different than mine, and we can continue to be friends. And how would that differ in a client therapist relationship?
Yeah, I think that we get offended, or we struggle in values when someone's differing value um, causes or makes us feel or causes us to think that our value isn't good enough or needs to change or adjust to align with their stated value. Right. But like you just said, if we can say we have differing values and that's okay, there's no threat to our value system
Mhm.
or perceived threat to someone else's value system. We can hold competing values and it be okay.
So it's kind of like the guilty conscience concept. Like
Yeah,
if I'm insecure about my value, then when someone throws something that makes me feel shaky, I'm going to become highly protective and defensive.
yeah. Or if I feel uncertain in mine, I need everyone to agree with my value to affirm it.
So like a narcissistic kind of need in a
Yeah,
sense. Okay.
yeah. So the less we're aware of what's driving our values, the more assurance we need that our values are correct. And so the more we'll impose them on others and need other people to agree with our values.
Hmm. So now you're actually saying something really interesting, which is I think at the core of a good therapist or a good parent, frankly, or any good authority figure, which is the more secure I am, the better I can hold you,
Mhm.
right? And you're applying this concept to values and beliefs and impositions that may occur between therapist and client that are unrelated to personality, but related strictly to whatever values we may be talking about.
Mhm.
So if you trigger something that's insecure in me, then I will somehow have an unhealthy response, which will negatively impact the dynamic between us.
Yeah.
Would that be about right?
Yeah, I mean, it's similar to what I say when I did in-home therapy in Boston for years with children. And I'd go into the home and the parents would always be amazed that their 5-year-old throwing a fit. I would just kind of stand there and calmly wait until they calm down. And the parents would be like, I don't know how you can do that. And I'd explain, I can do that because I have this little mantra that I tell myself, and it's this is not my kid, and I'm done in 50 minutes.
That's right.
Right. I'm the professional. And so, yeah, I mean, part of that is I have a different value. So if it's your kid and they're throwing a fit, your value says, my kid needs to behave. I
I'm
want them to
responsible.
listen.
Yes, either I'm responsible for my child or I'm embarrassed of my child, but they have to behave. Exactly.
Right. Whereas
But
me, like, I'm a therapist. Like, it'd be good if you can behave, but, I leave in 50 minutes.
mhm. I wonder if you've ever asked the in-home therapist who came to your work with your child that question. How could you do that? Okay, it's interesting because I actually did in-home therapy for about 12 years here in New Jersey with the crisis intervention program. So how do you like that?
Okay. Yeah, I was an ACT clinician in Maine.
Okay, ACT Act, right?
Yeah, yeah. Assertive community treatment, not
Oh,
acceptance
not
commitment
acceptance
therapy.
commitment. Okay,
Right, right.
okay.
It's too many
So,
acronyms.
yeah, right. Okay, so I'm hearing you say that there's somewhat of a solution here, or at least the beginnings of a solution, which is to be mindful of, I'm going to use the word biases. Is that a fear
Mhm.
word? Okay. Let's try to take this into, a little bit more of a practical realm. And again, I encourage those of you who work with people of different values, faiths, cultures, to please chime in, share your experience, or ask questions. I'm going to admit that most of my work, 99%, 95% of my work has been in the Orthodox Jewish population. There's only been a number of cases or clients that I've seen outside that population. But to hit home on your point, Seth, one of the greatest challenges of working with people within your own community is the assumptions that you make about their beliefs. It's even worse than working with people outside your community, because when you're working with someone outside your community, you know that you don't know all their values and faiths and beliefs. And when you're working with someone within your community, you think you do. And that is, that's a very big challenge and something that's always on the forefront of my mind. So what would be your recommendation in working within your own circle, or seemingly or ostensibly your own kind of people, whatever that means?
Yeah, I mean, that's a key point, right? Our worldview is not what we say it is. Our worldview is what we do. And so, as an evangelical Christian, and I think even as an Orthodox Jew, we would hold prayer as being a very kind of important tenet of our faith. And so we would say, if you ask somebody, well, what do you believe about prayer? They would say, well, I think prayer is critical. It's very important. It's, the opportunity to communicate with a higher power, with God. You'd say, all right, well, that your worldview then would say that prayer is a critical thing. So what do you do when something happens? Is prayer your first response? And frequently it's not, which then would say, well, your belief system then doesn't align with your practice. And so your worldview is what you do, not what you say you think you would do in any given moment. And so with any of us, regardless of our belief system, there's a disconnect between what we think we believe or what we might espouse on paper as an appropriate worldview, either theological or secular. What is our understanding of the world? How does it work? And then what we actually do. And the difference and the gap between those things is really the mainstream culture around us that conforms us in view of world and experience. And so one of the first things I do is we kind of have to identify what your worldview actually is, what beliefs and assumptions you would hold. So it wouldn't be, it's not much different than REBT, than rational emotive behavioral therapy, when we're trying to say, all right, well, what beliefs do you hold? Are they rational or irrational? How do we challenge them? The difference is it's not just driving your consequence. It's actually informing your lens of the entire world, but operating in our preconscious or unconscious in the assumptions that we drive.
So tell me a little bit about how that looks. In other words, I have some preconceived notions, let's just say, about Orthodox Jews. Let's use your prayer example, right? So how might that manifest in ways that would be incongruent to the client's experience because of those assumptions and biases that I have?
Yeah, well, a lot of times you'll see a lot of the good REBT stuff come out like shoulds. And so people will say, well, I shouldn't be dealing with this, or I shouldn't experience this. And so you say, well, that's a value statement right there that you just made. Where does that come from? And how is that impacting your experience in life? And for me as the counselor, I might be thinking the same thing. I might be saying, well, you're an Orthodox Jew. You shouldn't be experiencing this. This should be this peace. But none of us live in perfect alignment with our belief systems. And so it's trying. I usually try to approach sessions, or even my own life, by identifying the lenses that I'm using to make value statements. And so as we discuss things, if we try to identify them as a value statement. So you'd say, well, prayer is important. I feel like I should have prayed about this, or I can't believe my children are behaving in this way. It's like, all right, well, let's make a value statement about that. What is the value? Well, children should listen to their parents. Or if you're a good Orthodox Jew, you will pray. I was like, all right, well, where does that come from? What's the basis of that belief? And is that an accurate belief within your value system, and your belief system? Would other You can use some of the self-compassion stuff. So if we polled, Orthodox Jews in this call, would they agree to that as part of your belief system? Is that a valid understanding? And if it is or isn't, then you evaluate it. If it is, You say, all right, well, how do we live then in congruence with our belief system, in expression of our values, to drive our purpose and to produce virtues in how we live? Um, and evaluating through that. And then every belief system has their own kind of perception of grace. How does grace work? How does it work when you don't live in perfect congruence and alignment? What does your belief system say should happen if you can or can't do that?
Mhm.
Because my job is not to tell you what my belief system says. My job is to help you understand what your belief system says
Mhm.
and evaluate whether that's working for you and whether you're living in alignment and congruence with it. Um, and if not, what needs to change?
Mhm.
So do you need to change what aspects of understanding your belief system, supports for applying that through your values, understanding it for your purpose, or living it out in your virtue? How do we make adjustments so that you can live in congruence across
Mhm.
those areas?
Okay, so here's a question that I could see, becoming a sort of dead end in the therapy session. So I'm treating a client, and he believes or she believes that, let's go back to the example you gave earlier about children have to listen to their parents. I was actually going to bring that up. The kids have to listen to their parents, don't they? And so if the kids don't listen to their parents, they have to be punished, because punishment will teach them to listen to their parents. Now, a more sophisticated view of parenting or real discipline will support a much more sophisticated approach to parenting, which might include discipline, it might include consequences, might include what some people would call punishment. I don't know, but certainly consequences, right?
Mhm.
And this person comes in with a very black and white. So here we have value based, that my belief is that children have to listen to their parents. And if my children aren't listening to me, then I'm going to spank them, or I'm going to punish them, or I'm going to deprive them, or whatever it is. And I'm very, very sure about that. That's the way it has to be.
Mhm.
And I might come in with a suggestion or with data if I want to cover myself and feel smart. I'll come in with data supporting that it's not true. And they come and they say, well, I believe that your assertion is from secular information, and I don't believe that that's what the Torah or Scripture expects. In fact, it says, what is this,
Rod of correction.
yeah, it's a spear that no, I forget the verse now that I'm on public display, but
Try,
spoil the
try
child.
to
Fear
say,
the rod.
try
Spare
to
the
say,
rod, spoil the child, right? How does it go?
Yep.
yeah,
Okay.
hate your child. That's what it says. But
Okay.
then,
So the point is, right, that they'll back up, and so now we have value against value. I'm coming as the expert, quote unquote, and they're saying, well, you're heretic. I mean, that's not true. That's just not, and so again, I'm giving a sort of oversimplified example because it's in a circumstance where I may be giving parenting advice or parenting data, right? But obviously this can happen in a more therapeutic, just to keep things clean. So now what?
Yeah, I mean the reality is nothing is value neutral, right? And so even the expectation that in a clinical setting we don't impose values is just not true. Because if someone is using physical discipline, uh, punish corporeal punishment on their children, we have to evaluate, like, all right, are they safe? Which is a value imposition. But yeah, it's evaluating with them what's driving their assumptions, and understanding that. And frequently it's, well, it worked for me, um, or I was spanked and look how I turned out, or yeah, looking at the text and saying it says, the rod of correction, the staff, what does that mean? And so the value difference is to some degree a hermeneutic or an interpretation of both lived experience and textual experience. And so I found most of the time in my experience, while people want you to tell them what to do, they only are going to listen if what you tell them is what they already wanted you to tell them. It doesn't work if counseling was just about giving advice, we'd be great, right? But
Well,
people
everyone
don't.
everyone would be counselors then.
Well, no one follows the
Well, Jews
advice
would
you
be
give them
counselors.
anyway. Right. So just, if if all we needed was advice, we would all turn out great because our moms gave us great advice growing up. And so, yeah, it's
And
that
our advice would come from, I was spanked as a kid and I turned out okay, so it's okay to do it. Or I was spanked as a kid and I was miserable, so it's not okay to do it, right? One way or the other.
yeah, well, it's skewed results. Or it's, I heard someone say the other day, like, we played on rusty old play equipment and we all survived. And I was like, but what about all the people that didn't? Right? That's a skewed stat.
That's right. That's right.
So yeah, if we're basing it off of experience, we have to explore that experience and say, okay, so this is the route that you feel like it's going to go. What is the goal? What's the goal of disciplining your child in this way? What are you hoping to accomplish? Um, and if we're looking out here, how do we map that to make sure that what we're using as a mechanism is going to produce the result that we want?
So almost
And
like
so,
Socratic questioning and like something like that to get them to
yeah.
see. Okay.
So if it worked for you, did it work every time? Were there times that you resented your parents when they spanked you? Um, and and what would you have wished they would have done differently potentially?
Mhm.
Or what are your other options, right? Most of the time in parenting, it's we don't plan ahead, and so we don't have many options left to us.
It's the kids who weren't born with the instructions, right?
That's right. Yeah. So it's saying like, all right, well, what do we value? All right, we value children to obey, to listen. Um, and what produces that, and how do we know if it's working or not? And what is normal or expected at each age and stage? So if you have a 3-year-old, 2.5-year-old who's misbehaving, sitting them down and trying to tell them what their future is going to look like, it's not going to be very effective. Um, so it's thinking through each of those pieces and
Mhm.
and trying to clarify what the values actually are and
So
what they're based in.
your role is really to explore and to help them come to some conclusion on their own based that will still jive potentially with their values, or they'll shift their values because the values are rigid based on whatever defense mechanisms they're using.
Yeah, to expand their perspective around what their options are and not foreclose too soon.
Seth, I feel like there's two things you're saying here. I feel like you're saying there's work on the therapist's end to explore his or her own biases and values, and then there's work on exploring the client's values and where they emanate from and what the meaning is behind them. Is that about
Yeah,
right?
I think we are constantly making sure that we are not just driving through our own assumptions.
So
As
how do we capitalize on that to make sure that we're not blind, blind faithfully?
Yeah, I think maintaining curiosity is going to be a critical skill of continuing to ask that question of ourselves and of the clients. It's like, what's the first thought that comes to mind? All right, well, why did I think that? Like, where did that come from? What influenced that perspective, that value, that assumption?
Mhm.
Um, and then either putting it out there to challenge it, um, or asking a broad piece. So saying something like, okay, so it sounds like in your upbringing, there were certain methods of discipline or punishment that were used. Well, tell me more about your experience. Instead of assuming like, oh, well, you're over 40, so you probably were spanked as a kid. Um, and so it's being able to kind of reserve and check our own assumptions and evaluations from our own experience. And I think we're most likely to, as you said earlier, make those assumptions if someone is similar to us or we perceive them as being similar to us.
Mhm.
Right. So if you're only seeing Orthodox Jews, you're going to assume that everyone did the same thing as you. And there's going to be enough um, correlation that will be true most of the time. But it's those few times it's not true that will just blind you to that assumption.
And I think not only blind you, but it will it could potentially create a great rupture in the relationship, because there may be people who are ashamed of parts of their religiousness or religiosity, or however you might say that. People who are, you have people who are angry at God, or people who have left the faith because of whatever challenges and struggles they've been through, and then you have people who look the part but don't necessarily feel the part. So if the therapist is coming in and sharing certain assumptions or speaking to them in a way that implies that they have certain assumptions about their belief, they may be too ashamed to fess up and be truthful about what they're really experiencing.
Mhm.
So that could be a great rupture without like you're saying, that curiosity.
Well, and being able to put it out there, right? Because I mean, even people come in, I'm in my office at work right now. People come to my office and they see my bookshelves and they start scanning things. They know things about me through disclosure because of what's on my bookshelves.
That's right.
They know things about you and your disclosure because of how you dress, the things around you.
That's
And
right.
those are methods of value imposition that we could try to check for. But then that's impinging really on your own expression of religious freedom.
That's fascinating because this has come up for me on many occasions where people have looked at the way I dressed and made certain assumptions about me that are not actually true, just based on the way it's their assumption
Right.
about someone who dresses the way I dress, that their basically projection that if he dresses like this, so he's this kind and exactly in this sect and probably has these beliefs, and asked me where I did this or where I prayed or where I this, without even knowing if I prayed or if I did this or if I believe that.
Yeah.
And I found that challenging as a therapist because it's triggering for me. I have to kind of ground myself after a client makes those assumptions or says those, and then start to again, run through my mind what's appropriate to disclose and not disclose. How can I just kind of let that go? Like you said, it's not my kid, so I don't have to worry about him. It doesn't matter if somebody's making these assumptions about me, but it kind of does, because think of the reciprocity. If somebody's making these assumptions about me, then they also may be assuming what I think about them, being what they think about me and who I am. So like now we're in this this sort of dyad, this very fascinating, complicated dyad or dynamic in which they're making assumptions about the way I think about them because of the assumptions they have about me.
Mm-hmm.
How do we, how do we clean all this up?
It sounds like the scene from Princess Bride, right? Where you're passing back and forth the cups, saying like, well, you think that I think that you would think this. And because we are the one in the power position as the counselor, it's our responsibility to, I think, stop the system
Open it up.
and and say like, a lot of people might assume that these type of things about me based on how I dress. And I'm sure you might not do this, but it's possible that because I present this way, that's what some people think. Have you ever been misunderstood and people made assumptions, right? And just kind of open the dialogue through curiosity, through open questioning, like a Columbo model.
Well, what I like about what you did is you also kind of stepped away from or avoided having to disclose, rather than saying, well, I actually do or I actually don't. You stepped away from disclosing and saying, has anybody ever made assumptions about you in that context?
Yeah, it's more that I use a lot of the meta, right? So we talk about what we're talking about instead of talking about it, breaking the fourth wall. So even saying, like we were talking before, it's like, well, what does it mean to be an evangelical versus an Orthodox Jew? And saying, all right, well, how would that impact our differences? Right? Instead of maybe breaking down, well, we disagree in these areas, say like, well, we hold to a value of life and
Right.
the desire for dignity of people. So let's focus on these things that are unique but similar.
I think it becomes very challenging. See, there are differences that we can appreciate about each other. If I'm a Democrat and you're a Republican, or vice versa, we can appreciate, if we're mature. Let's assume we're mature people. We can appreciate differences by being curious about the other person's position and perspective. I think it gets challenging when, how would I say this? When let's just say a value or a belief system of a client is in direct conflict with, I guess, either something that's integral to the treatment. I'm trying to think of a good example, but let's say you have extreme versus moderate. Okay, so I believe that things should be balanced. I'm against extremism of any form. Things should be balanced. Maybe a little more to the right or a little more to the left, but balanced, which basically means tolerance and understanding other perspectives, even extremism, I guess, right? And you believe that we have to take hardline extreme approaches. That's the right way, especially when it comes to scripture and things like that. This is what it says, this is what it is, and it's the only way. and we find this a lot, I know in our community we'll find a lot of this where it's like, no, there's rules and regulations, and so you have to abide by them and you have to go by them. And then there's others who are a little bit more liberal. I'm not talking about very liberal, but just in there's rules and regulations, and then there's also understanding, and tolerance of people who struggle with the rules and regulations for whatever reason, right? And so you have somebody come into your room, let's say you're more of a moderate and they're more extreme. And I guess it's kind of similar to the case of the parenting, right? And so their struggles and their challenges are being driven by their, I'm not sure which came first, the chicken or the egg, but it's like you want to sort of help them recognize that their challenges and their struggles are going to continue and be perpetuated by their extreme hardline or OCPD kind of behaviors, right? And but then when you rethink it, it's like, but maybe I'm coming from a place where I believe that being moderate, is the best, most effective way. But what if I thought for a minute and I said, what if I were to be extreme or hold the position of the extremist, and at the same time want to try to reconcile being calm? So they're saying we have this extreme position, but it's putting us in tremendous conflict. So let's try to take something more concrete. I have this very extreme position that I have to wake up at sunrise every morning because that's the best way to serve God. I don't know, right? So I have to wake up at sunrise. Now I also have insomnia, so it's hard for me to sleep at night, right? And or I have a family or a job that ends very late, and it's very difficult for me to go to sleep on time, where I need 10 hours of sleep. So it's my value and belief system is in direct conflict with how I'm going to interact and work in life. Now, I, as the moderate, say, well, you can't have both. So, right, and it probably isn't so important to get up that early. So how am I going to reconcile that in my treatment with the client?
Well, and the other conflict would be our contemporary Western worldview would say, that if that's not working for you or good for you, then it might not be what's best for you. Whereas
you should be modifying it,
right, because it doesn't meet your needs. Whereas a more collectivistic, historic lens would say, like, your needs are kind of secondary to
that's right.
to the religious.
Figure out how to deal with it. Exactly.
So yeah, we have to catch that too, because I think counselors frequently impose that individualistic lens. So I mean, I would explore, like, if you have, I mean, we see this not just in an individual, like your example, but in couples, right? So if you're seeing a couple, you can't just affirm and agree with whatever their issue is when they're at diametrically opposed situations. So the assumption that a compromise is the solution isn't always an available option. So you just explore what are your choices then. Which values do you hold if they're in conflict with one another? How might you do it? And it seems like in most of the work that I do, the more you can make things explicit and concrete directly in front of you, instead of implicit and assumed, then you can deal with it. Right. So putting them all out there on cards to say, all right, I need to get up at sunrise. I need 10 hours of sleep. I can't sleep at night. Let's put all of these things out here so that we can see them directly in front of us. And then make decisions based on what we see directly in front of us, instead of being, as the counselor, which I've gotten into this trap, like throwing out suggestions that are just like batted down each time, because they don't need to come to a solution. They just know that your solution isn't going to work. So instead, we lay all of our pieces out and say, all right, well, which are values? What are the values that we hold? And how do we order our values? How are they aligned with our beliefs? And do our beliefs drive the right values that we hold?
Okay, excellent. I'm going to ask you something like a specific kind of question. Again, I'm going to just pick a scenario, and of course, this could be applied to many cases, and then we're going to get into something a little more sticky and touchy. Okay, so let's say I have an Orthodox Jewish client who's seeing me, who is violating a very obvious, unarguable commandment and they're talking to me about it in my practice. So there's an elephant in the room. Okay, so you have a client who is engaging in an extramarital affair, let's say, or whatever, what have you. That's a classic example, right?
Mhm.
Now there's a pink elephant in the room, which is he or she knows that I know that they shouldn't be doing this based on their culture, on their, I should say, religious values. And they know that they shouldn't be doing it based on their religious values. Okay. We know that pink elephants are never good things. We also know they don't exist, but that's besides the point, right? So what do we do with this information that's sort of implicit and unspoken? And how do we work that in the healthiest, most effective way for the therapy?
Yes, I guess the first question that I would have for the client would be, is there some expectation that you have in sharing this with me that is tied to our shared religious background? So, is there an expectation of absolution or of shame or of guilt or of affirmation? What do you what are you hoping in sharing this with me personally, not professionally? What is that expectation? And then stepping back and saying, well, does this align with how you choose to live your life? And then does how you choose to live your life align with your stated belief system? And could it be that the tension you're dealing with is this disconnect between your stated belief and values, not lived out through appropriate virtue, regardless of how I feel about it or what I think about it? Because you're in conflict with your own values.
I really appreciate the way you phrased it. I'd love to hear from the participants. What might you say to a client to address this pink elephant? What might you have said before listening to Seth? I should have really asked them before, but what might you have said, or what might you say to a client who discloses this kind of information, where again they're generating this pink elephant because they know that they ought not be doing this, and they know that they ought not be doing this based on their values. And then I want to go back to the way Seth phrased it, and I want to sort of break that down to see what it is that you did that felt that right. Anybody? Shashi? Anybody have any idea of how might you address that? Shashi, I knew I can count on you. Wait, you're muted. You're muted. We're gonna unmute you. So you have a client who acknowledges or talks about an affair that she's having. Okay,
Yeah.
she knows that you know that that's not okay because she's an Orthodox Jew. You know that it's not okay. She knows it's not okay. What might you say first of all, would you say anything or just go with it? And if you would, what might you say?
So actually, I had this story when I was interning, and I had a client that had, she was not married. She had a Black boyfriend, and she was a Hasidic girl in the past, ex-Hasidic, was definitely from a very ultra-Orthodox family. And she was having a lot of hard time with relationships in general. She was really close to 30, and no relationship ever was good enough. And she described that this relationship was really amazing and awesome for her. And it's the first time she could feel close to a person. And because he was from minority, he was able to understand her. And I so went along with her and so acknowledged her emotional connection that she had, that I totally, in a minute, it was in my brain, like like I was thinking about her mother, because I'm a mother too. So I was thinking, like, I wonder what her mother would think if she would see me sitting there and acknowledging all that and feeling so supportive of her. And when the session finished, I was still in school. We still had a class with I forgot what it's called, where you have the ethical dilemmas. And then I brought it to he was a rabbi and a doctor. And I brought this as an example. And I said when I was sitting with a client, I totally forgot, like it was out the window, the values. It was only about, I still don't know till today day if I did the right thing, but that was and I think that's the only way I can do it. I
Yes.
don't know that I can do it
Is to
any other way.
to put your values to put your values aside is what I'm hearing you say.
Yeah. I think that if we were to continue for a long time with that boyfriend, she ended up breaking up with him like the next session. Maybe I would have asked her how she feels about him being so different than the value system she grew up in. Maybe, I don't know. But I think I would put my values aside, definitely in the beginning of our times together.
Well, I think the therapeutic experience for her sounds like it was phenomenal, because if you're able to do that, then she's really able to heal. What didn't happen in that session is what Seth's suggestion about how to deal with the pink elephant. In other words, what you did was you completely compartmentalized and stayed focused on the therapeutic aspect of her emotional needs and her emotional connection. I think Seth is raising a point of when a client is sharing that with us, specifically knowing that this is going against our values, or at least specifically assuming that it's going against our values, right? Then there's value in bringing that itself up. Like, what is it to you, or what is it for you to share this with me?
Right.
Is that, Seth, am I getting that about right?
Yeah, because I mean, the reality is either way, it's a value. So letting it go and saying, well, you should be happy. I'm glad that that's working for you. That's a value as well. That's a value statement. And it may or may not align with their purported worldview values. It may be an assumed cultural value that they've kind of adopted, that's actually in conflict with what their desired values actually are. And they don't realize that they've kind of assumed this cultural value of you do you, and don't understand why they're dealing with internal conflict in the choices that they're making. And that's what frequently happens is we have stated beliefs, but we live in conflict with our own stated beliefs because the mainstream culture around us is so much more robust. We spend so much more time influenced by it than we do even our religious values often. And so it conforms us without us realizing it. And so we deal with the guilt and struggle of that conflict often without realizing that that's what it is, that it's actually a conflict of our belief system and our value system to our practice.
Excellent. Any other questions or comments on that before we proceed?
Yeah, can I chime in for a moment?
I don't know who this is. Did you raise your hand?
Yeah, Shandy.
Yes.
Oh,
I just want to tell you, you just gave me so much clarity regarding a case that a client that I'm working with right now, that's actually married and having an affair at the same time. You just gave me clarity that why she's just not able to deal with it properly because of their inner conflict based on her value system. And I just appreciate it so much. So I just want to say thank you for that.
Yeah, that's great.
excellent. Comments are welcome. Hey, Yosef, do you want to unmute?
Yeah. Is it really possible to fully compartmentalize in the sense that we put aside our values, which we strongly believe in, and maybe even our religion or our values brought us to this profession often. And when we have such a case where there's someone that goes against our values, just to fully ignore it and actually just work with the therapeutic part.
Yeah, I think it's it's probable. Then that's how we're trained. The catch is that in and of itself is a value. So it's not as if us compartmentalizing our values to allow the client to deal with their values. The assumption of value neutrality is a value. And so if we perceive people as spiritual as well as biological, social, psychological, emotional, then if we just ignore values or spiritual components or faith components, we're not treating the whole person. And so we aren't necessarily doing ethical, effective work by considering their needs in values, faith, and belief. But it requires that we wade into it.
Can I ask a question on that?
Okay, go ahead.
Is that okay? So, how do I relate to a client, or what would be my work when she declares that she does not want to have anything to do with anything Jewish? She's done being Jewish. She wants to be totally, not a secular Jew. She doesn't want to be Jewish at all. And that's all she speaks about all the time.
Send her to Seth, we'll make her evangelical.
Yeah. Or, it brings to mind that the Shakespeare quote, right, is "Thou doth protest too much," right? If, what is going on that you have such a strong reaction to your Jewishness that
Yes.
that's the topic that you're bringing up.
Right.
But-
Yes.
Oh, and we can't forget
is-
that she's choosing to work with an Orthodox Jewish clinician.
Right.
What does that mean?
Right. And she's coming to me after a break and came again to me 2 years later at the same clinic. But she can't stand, she only wants to eat non-kosher food. And we know that she has a tremendous history of trauma in her family. So we're speaking about that, but I can't even bring up the question of what does it mean for you to live different than your value, because right now her value is anything but Jewish.
Mm-hmm. Yeah, so I do an exercise that's called the 20 statements test. And it sounds really official, but it's just like a blank sheet of paper with 20 lines on it. And it asks this question of who am I? And see if you can list 20 characteristics or traits about yourself to define yourself. And then we work from there to identify like components of identity. What informs those components of self, those senses of self? And you can choose to restrict it, right? So I sometimes restrict it to say like, all right, it can't be any of your relationship roles, or it can't be cultural or racial, or it can't be and see kind of what am I using to define myself in relationship to other people, because that's a reflection of my values. That's a reflection of how I want to be seen and understood.
Can you repeat that last sentence or two?
Yeah, so the way that you describe yourself is a reflection of your values and how you understand yourself in relation to other people.
Okay, got it.
Our only way of defining ourselves is in connection to others. Identity has to be relationally framed.
Okay, well, Shashi, stay on because Seth, in case you couldn't tell, Shashi's Israeli. In case you can tell by the accent, and we're going to get to her topic soon. But Shava, go ahead.
Hi, so this topic is so interesting for me because I specialize in sex addiction. So, it's making me question because I really never even thought of questioning them, like what it feels like. But I have my clients telling me, about all their acts of the week. They know everything that's wrong, all the violations. They even sometimes will look at me and I'm just sitting there taking it all in and I'm like, and they're like, why are you okay with it? Why are you not asking me why? It's, all that. And I say back to them, because that's why you're here. I mean, that's your whole challenge. That's your struggle. And you're here, for me to help you work through that. So obviously I'm okay with it, you know, and I never even thought of going into, you know, more questioning them of like, why, you know, what's bringing them to, you know, ask me that question. I'm wondering if I should, or should I just leave it neutral like that?
I mean, frequently it's trying to get a response from you as part of the dopamine reward system, right? I mean, if I can talk about my acts and get a rise or even a reaction out of you as the therapist, that's a high as well. And so, yeah, your neutral response is beneficial to kind of circumvent that. But to some degree, it is this, you know, it's like motivational interviewing is what's driving the decisions that you're making. You're experiencing an aspect of ambivalence in your change, but that's tied to your values. And so, yeah, it's exploring like when talking through and trying to enhance the ambivalence, uh, evaluating each of the values on both sides, and not just the behavior or not just the unconscious piece. Is what are you working towards?
Mm-hmm.
Because it's all value driven. It's either a value of self gratification versus others, or
You're saying I can explore that to see where it's coming from. Why are they asking?
yeah.
Or why they're sharing the information with you? What is it that is there something they're looking for?
It's more like an update, you know, in the beginning of the session, like just to go through the week, like were there relapses? Was it going great? You know, just to get an update and then move on. But sometimes you'll see them, you know, wanting to go into all the details of the whole week. And, you know, that's making me think maybe that's for that, you know, some motivation there. So you're saying when I see that happening, I should maybe stop in its tracks and question it.
Yeah, because they've slipped their identity into the role of sex addict, and so there's a benefit to continuing to struggle as opposed to overcoming their struggle,
Mm-hmm.
because their identity is now the behaviors that they're doing, and so it's a vicious cycle now instead of an outlet.
Mm-hmm. Right. More craving the attention.
Right.
Mm-hmm.
So then you gotta starve the attention to produce effective change.
Mm-hmm. Got it. Okay. Thank you so much.
Seth, here's the big question of the night.
Yeah.
So I'm an Orthodox Jew or a secular Jew for that matter. And one of my clients is a native or child of a Palestinian, or maybe we won't go so extreme and say a native of another Muslim or Arab nation. I've been able to put everything aside and stay professional and really begun to care about the client and the person. Now they're talking about how their family in Gaza is suffering because of the atrocities that the Israelis are, you know, putting them through. And I'm finding myself very triggered by that.
Mhm.
Okay. Must I stop working with this client? What happens now?
Yeah, so the question becomes, can you align with in compassion with their perspective experience, without affirming their biased lens of cause, right? So we can all align in our compassion with someone fearing for the life of their family, experiencing loss, being out of control, not understanding why things are happening or disagreeing with why things are happening. But is if the scenario is an intentional affront to your sense of safety as a counselor, which it could be, um, I would even just ask that question for the sake of the client.
Yeah, I wasn't going to go that far. I wasn't going to go that far.
Okay, yeah.
We could look at that separately. But let's say they mean it in earnest. They don't know that I'm Jewish.
Okay, yeah.
There's no way to tell, right? So, or with a you know secular person who doesn't look Jewish. So, is it even possible? Is it even reasonable to think that the counselor can separate that from themselves. Again, I appreciate what you're saying, which is ideally that's what we should be doing. You know, we come across this all the time where people are doing things that we think are stupid, like you're just self-sabotaging, right? But we can appreciate that people struggle, and just because we don't struggle with this particular thing, we struggle with something else.
Right.
But here you have this is something that's so highly triggering, that's so press and media triggering, you know, because of, you know, you're watching we're watching protests and demonstrations, kill the Jews, you know, all over the world, and now you have somebody coming in who's in a sense representing that.
Right.
Is it even reasonable to think that somebody can actually compartmentalize like that, or do we assume that they're going into denial and they're really not going to be fair to the client?
Yeah, I guess it would be the difference of whether it's compartmentalizing or whether it's maybe depersonalizing, right? So you can to some degree separate your experience without having to compartmentalize, but say this person in front of me doesn't hold the same values that I hold. And while it is directly affecting me in what they're saying, if they agreed with me, would it change how I view them? Because you're still not separating them. So if you have someone that comes in that's the exact opposite scenario, you're not separating either, but you wouldn't even think of stopping that session because you're in agreement. And so if you're in disagreement, or if you're feel kind of personally targeted or triggered, it's a question of, does that prevent you from being able to provide perspective for the client? And are the needs of the client going to be impaired in some way? Because it could be impaired in the exact same way if you're in full agreement as well. It doesn't have to be conflict.
Excellent. And then I guess I wonder, I'm just going to wonder out loud. Suppose the client didn't know that I was Jewish and was going on an anti-Semitic rhetoric, or an anti-Israel rhetoric, which seems to have become synonymous. I guess technically I can work on that same thing, but would it be important that I disclose to the client that I'm Jewish, and have them and work this through with them, or a risk that they might actually find out one day and feel betrayed?
Yeah, so I mean, I would tend to, in anything that tends to be extreme, or that is has social ramifications. Part of the role of counseling is helping people prevent harm for themselves or others. And so I would usually just like kind of interrupt and address and say, you know, what you're saying is pretty volatile, has the potential to be kind of a heated topic in the world around us. And so how can we kind of understand what your experience is without provoking response or reaction against you, in how you think about these different things?
But okay, are you not imposing a value then on them right there?
I'm trying to protect them from themselves to some degree. Yeah.
Okay, they feel that they feel that martyrdom is okay, let's just say. So it's really okay for them to be provocative and pour gasoline on the fire. And so are you not imposing, would it be more appropriate to I guess inform them of this risk and ask them if that's okay with them?
You could, I mean, it's similar to when I worked with kids, and they, as an evangelical Christian, growing up in like a strong, strict Christian home, we didn't use swear words, right? We didn't say like the F word. And so I had clients all the time just dropping it left and right. And frequently there is people would ask me, well, do you tell them to stop? And I said, no, like I don't really care if people swear in front of me. But if it's an adolescent and it's going to get them in trouble at school, my intervention was usually, that's amazing how you can use that word as every part of speech. can we teach you how to more effectively communicate in a way that isn't as offensive to people around you, which is a value
That's
judgment.
value. Mhm.
But it's a cultural value. So if you, even at a public school, if you use the F word, you could get spoken to. And so it would be this similar piece of saying, well, you hold these beliefs aren't shared by everyone,
Mhm.
and can cause tension for you, in your workplace, in your environment, in your friendships. And so what are ways that you can either recognize the impact of your beliefs on other people and
Mhm.
choose to be that way, or just making the client aware of what those beliefs are potentially, because maybe they're so surrounded through social media that they don't realize that what they're saying is as offensive as what it is, right?
Mhm.
We're in such
Social-
echo chambers.
Yeah, lack of social awareness. Seth, I think I'm hearing you say that you might avoid self-disclosing in the spirit of generalizing the problem in the client's behavior. Is
Oh yeah, I
that
use a lot of like hypothetical, like friend situations. So like, how do people around you respond to this? Are people offended by what you say?
Mhm. If you knew someone, if your friend Thomas would do this, how would people respond to it? But again, in terms of the self-disclosure, this might be a challenge between us because I'm Jewish and you're talking about, would you not go there directly, not disclose directly?
I think it would depend on whether that would,
Make it,
create
make it,
actual change or not. Right. So if you said, oh, well, I'm Jewish, they might say, oh, I'm so sorry. But then they won't actually address anything with you, and it won't change anything that they're doing. They just won't tell you. And then it's not very effective. Where if you can use your self-disclosure as a position to represent potentially other Orthodox Jews and how it impacts the culture at large and not just you as an individual, then that would be a beneficial self-disclosure because it's helping them in their social engagement with relationships.
Mhm.
Uh,
What would you say when the client directly confronts you? I was going to ask this earlier in other scenarios that we brought up, but they directly confront you about what your position is and what your belief is. So, don't you agree that Palestine, that Israel, don't you agree that people should be doing this and shouldn't be doing that? How could you not agree with that? What would be how would you sort of get out of that?
yeah, I
I know what
pivot
I
and
would do.
dodge.
What's that? You
I
dodge.
pivot and dodge.
Pivot
Yeah.
and dodge. Well, I suppose it seems like it's important for you to understand what my position would be on it. Tell me what that means to you.
Yeah, I mean, why are you asking this question? Like, if I agree with you, does that make you feel better? If I disagree with you, that gives us something to debate, which is fun, but might not be therapeutically beneficial.
Mhm. So pivoting.
Yeah.
Any questions or comments on this? Shashi, I don't know. Are you raising your hand? You're muted, so I'm just gonna ask you to unmute if you were trying to say something. Go ahead. Still don't hear you. You're unmuted, but we don't hear you.
Hmm.
That's weird. Has your car connection or something? Okay. Anybody else? Oh, there you are.
They can hear me.
Yeah, now I
There-
hear you. Now we hear you.
Can you hear me now?
Yes.
Okay. So I have another question, which is what if a client asks me, I hope it's okay that I curse in front of you because does it bother you? Now, if I say it bothers me, then it's about me. And I really do want to give her the full freedom. On the other hand, if I say it doesn't bother me, the truth of the matter is I can't say that I was that comfortable personally with all the cursing, but I definitely was able to see that she needed to express it in that strong of a way, especially that she was a very introverted type of a person, and I would never expect her to curse like that.
Mhm.
Do you realize the catch
Mhm.
that I was in?
Yeah, I mean, I tend to just say, language has meaning, and let's make sure we try to use it so that it's meaningful for you, and it's not just filler. So if the appropriate framing of your word is an offensive or vile curse word, but it best describes your experience, then that's a great opportunity to kind of have me understand what your experience and perspective is.
Mhm. And not answer if it bothers me or not.
I mean, a lot of what my clients share bothers me, you know.
True.
So yeah,
Yeah.
I mean, if that's the threshold, then I'm not probably going to do much counseling.
Right.
It's interesting. We have as one of the participants tonight a non-Jewish, I believe, a pastoral counselor. I'm not going to mention the person by name, but I'd love to hear what this discussion has brought up in him or her. And if you are in the capacity to unmute and talk, we'd love to hear your position. I mean, this must be very interesting for you. Okay, so please do. Yosef, go ahead.
Yeah, so I'm personally I recently graduated. I'm new to the field, so I'm just wondering in regards to this, when you talk about things that are uncomfortable in a way that you said, well, maybe if you don't feel safe in this place, then maybe you'll have to refer out. And I'm just wondering, as when we first start out, a lot of things are strange to us, and things that are not, I guess, things that are not familiar will often feel unsafe or uncomfortable. So how do we know when it's the right time to get more training, more supervision in this population, or where we say, well, this is not really something for me, something that I can do. This is not a value that I can help with, or a culture that I can help with.
Yeah,
That's a great question,
that's a
right?
great question.
I love
Yeah.
that question.
So my
Yeah.
I supervise a lot of students as they graduate and are associate licensed, and they often ask this question of like, when do I specialize? When do I pick my niche? And usually I say to them, when practically you have the capacity to be able to specialize, right? When you're starting out and you want to be able to eat, you need to see as many as many possible people as you can. And because you're under supervision, if there are people that are presenting with issues that you're not familiar with, seek out supervision to expand your repertoire, your competence as broadly as you can. Um, and then once you're able to be selective, that's when you get to kind of refine and decide. But yeah, as much as possible, when you're starting during internship, do the hardest possible thing you can, because you have the most layers of supervision and support possible. And then, yeah, when you're at your level, starting out building a practice, um, try it and seek supervision if you need.
Yeah, I would agree with that, and I think the more grind you put yourself through in the beginning, the more comfortable you actually become with things that you've never thought you might become comfortable with. So if there's a particular population, whether it's a mental health condition or a certain kind of person or whatever, that makes you uncomfortable, that's where you'd want to lean in until until either you've done it long enough and you can't come to terms with it with supervision, or you've done it long enough and you've become familiar with it and it's just not a population that you would choose to work with, right?
So I guess that's more in general. But would I know that this is let's say with the what we brought up with the Palestinian, that we may not feel safe. It may also happen in other places. How would I know that it's not a place where I feel uncomfortable and I may want to expand my knowledge, which I guess is something that has been said often, to do a lot at the beginning and to go in a lot of different things and expand your knowledge. But how do we know that this is maybe something that I won't feel safe in? Or maybe the answer is that try it out. So you if you burn out. You know that's not for you. That's
Yeah, I think that's supervision helps us recognize what our limits are, um, and whether a situation is, you know, beyond our capacity, or beyond our scope, or an area for growth. And so it's having a good enough supervisor, similar to, like, I played sports all through high school and college, and in those first, conditioning weeks before you actually get to start doing things and you're throwing up after running lines, repeatedly, your hope is that your coach recognizes your limits better than you do. Right? As I'm ready to give up, but my coach is making me continue to run because he thinks I can do more than I do. Supervision is hopefully like that and has an accurate recognition of where our limits actually are, which is probably a little bit different perspective than we have of ourselves. And so in good supervision, your supervisor would be able to say, maybe this might not be the right person for you because, their perspective is just going to be too grating, versus being able to say, no, I think you can learn and lean into this.
Okay, let's take, can we take one more question or comment? Diane? Go for it, Diane.
Hi. So, as a clinical chaplain, when I was taking my CPE training in the hospital, there were certain religions or certain people that I didn't feel comfortable seeing in the hospital, such as people who practice Santeria or certain beliefs that I was very opposed to. And in my training, I was taught that I am to be all things to all people. So pretty much if I'm seeing somebody who practices whatever they practice, even if I don't agree with it, I'm not there for myself. I'm there to provide counseling and care for that person. So I would have to put my thoughts and, my feelings aside and just be what that person needed. If that person needed someone, a listening ear, they just need a presence, that's my job. And then later, if, whatever I'm going through, then I can just speak to my supervisor, or, then I have my own counseling to deal with whatever I didn't agree with. So I find this topic very interesting.
Good, thank you, Diane.
Thank you so much for sharing.
Yeah, the struggle as a chaplain is that you are also supposed to kind of guide and lead in alignment with their belief system, which can get complicated sometimes, right? Is you're supposed to be all things to all people as kind of a representative of their belief system, which can be, because it is a little bit more of a value alignment issue
than a counselor who's more neutral. Yeah.
Right.
So, okay, well, Seth, that was quite stimulating, and it's getting quite late at night. So I want to thank you for coming on and joining us and sharing of your expertise.
Yeah, thank you so much. This is a lot of fun.
Yeah. Thank you, everybody, for joining. We hope to see you next week on Mondays with Moshe. And so long. Good night. We'll stop the recording if anybody wants